What if the age of HIV were over? What if everyone made treatment and prevention a priority? If everyone knew their status? If we came together to silence the stigma around HIV? This is what we live for. We live to innovate new therapies, working relentlessly to help people live longer, healthier lives. We stand side by side with the community, educating, advocating, not stopping until everyone is free from HIV. This is what we live for. We live for a day without fear, a day without stigma, the day when HIV is in the past, a day that's getting closer. This is what we live for. For the scientists who make discoveries. We live for everyone with HIV, for everyone who loves them, for the healthcare providers who care for them. All of this is what we live for.
You know, it's up and down. The first week probably was the hardest.
I've been sheltered in place for about 5 weeks, getting to the 6th week now.
Maybe we're in week 7. It all begins to blur.
I've been sheltered in place here in Atlanta for 2 months.
I'm losing my time and space, but I believe I'm in week 14 of the shelter in place for COVID-19.
I feel like it's becoming a new reality for me.
Now it's getting exhausting and overwhelming. I feel trapped.
And I miss the contact, the physical contact with other people.
I thought that most people only have to go through one pandemic in their lifetime.
And sometimes I think to myself, I'm not going to get coronavirus. But then I also thought that I would never get HIV either.
And my immune system is very compromised.
It reminds me a lot of when I was first diagnosed and I didn't know my T-cell count yet.
For long-term survivors, there's a lot of PTSD coming up around the early days of the epidemic.
We all, I think, at least I have a little box inside of a box inside of a box where I keep the late 80s. And this is opening up the box, and I'm thinking about people in a way I haven't thought about them since they died 30 years ago.
There is an incredible amount of unresolved grief. Incredible amount of unresolved grief.
A lot of what's going on right now feels familiar yet completely different.
I think the two are like apples and oranges.
It's not to compare the experiences as it is the sort of reminder of the extent to which those of us who were living those years really were living in another country, fighting a war no one saw.
Welcome to my world. This is the world that we've been living in.
It went on for us for 10 years.
Because COVID is about breathing, and that's something that everybody does, I think the stigma is different.
The people who get COVID-19 are not being cast as villains.
People didn't come to the rescue of people living with HIV back then. We only had each other.
I also believe that what many of us experienced during the 80s and the early 90s actually better prepared us for what we're going through right now than the general population.
Our trauma is our resilience.
We've learned that how we get through an epidemic like this is to depend on one another.
It serves us well to this day.
Hello, and welcome to World AIDS Day 2020. I am your host, Judith Light, and I am so honored to be a part of the National AIDS Memorial's annual World AIDS Day observance. The powerful voices we just heard are reminders of why we come together today. Like you, I remember so many of my friends who were lost to AIDS during the darkest days of the pandemic. It was a painful time then, and still just as heart-wrenching today, as we honor and remember them in our hearts forever. This year has been an unprecedented year for global health. Unprecedented even by pandemic standards, we face a grim reality. Our nation continues to struggle in the fight against COVID-19. The horrific loss of life in the United States now exceeds 250,000, and when it comes to treatment, we still know so little about how to fight this virus. 2020 also marks 40 years since the first cases of AIDS were reported in the United States. 4 decades later, nearly 700,000 lives have been lost in our country, with nearly 33 million globally, and there is still no cure. On this World AIDS Day, our hearts and minds open, we are spotlighting the interconnectedness between two pandemics that, while having their differences, have haunting similarities. We bring together voices from both pandemics, leaders on the front lines, for a timely conversation about health, science, activism, resilience, remembrance, and hope. They will share important insights and help answer the questions about how our nation responds, how it recovers, and what lessons can and must be learned for the future. First, as is tradition on World AIDS Day, we begin with an inspiring invocation offered this year by the Reverend Naomi Washington Leaphart, Director of Faith-Based and Interfaith Affairs for the City of Philadelphia.
Now let us pause for a moment of silence, contemplation, and prayer. Eternal Spirit, Earth Maker, Pain Bearer, Life Giver, Source of all that is and that shall be, Father and Mother and Parent of us all, we summon your presence here today. We need your hand to steady us as we pause to remember all that AIDS has taken from us. AIDS took our friends and friends of friends and friends of friends of friends, our lovers and partners, our given family members, our chosen family members, our leaders, our artists, our freedom fighters. And over the years, AIDS sometimes so overwhelmed us that we could not see our own dignity, our own worth, our own power. We could only see and feel the disrespect and the neglect and the stigma and the trauma. So we summon today the grace we need to grieve these losses, to count the costs, to speak the names, to remember. Because even in remembering the hard things, the sad things, the painful things, we are resisting. By remembering, we resist the ways that stigma and disrespect and neglect and trauma try to dismember us, try to pull our bodies apart at the seams, try to put wedges between us so we could not organize, try to shame us out of our relationships and communities. By remembering, we resist the indifference of those people and those institutions that believe our dead should be forgotten. I ask that this remembering, this stitching together of our lives and work be affirmed and blessed today. Even in the midst of our sober reflection about the devastation of AIDS, we summon radical hope and radical joy to this gathering. We are hopeful because we keep surviving. We are hopeful because our tears do not weaken our resolve. We are hopeful because this movement already possesses the power to live through and thrive beyond a terrifying pandemic. And this movement will continue to lead the way through COVID-19 and HIV/AIDS. We have joy because we know that the things which have tried to kill us, to silence us, have failed. We have joy because we know that even the slow pace of progress won't stop our work. I ask in prayer that this radical hope and radical joy be affirmed and blessed today. And I pray that every person here, every person who is involved in the work of wholeness, healing, and justice will be strengthened. I pray that every person will find rest. I pray that every person will know without a doubt that they are worth love and delight just because they exist. These things I call forth with gratitude and humility in the name of all that is true, holy, and human. May it be so. Amen. And blessed be.
For nearly 30 years, the National AIDS Memorial has been an important voice, helping share the story of AIDS so that never again will a community be harmed because of fear, silence, discrimination, or stigma. Each year, the memorial hosts our nation's World AIDS Day commemoration at the National AIDS Memorial, which is located in San Francisco, where many lives were lost to AIDS, and a city that has long been on the forefront of social justice. To share more about the important work of the National AIDS Memorial, please welcome Executive Director John Cunningham.
The National AIDS Memorial stands as a marker in our national landscape to ensure that the story of the AIDS pandemic will forever be known to future generations. Earlier this year, the National AIDS Memorial was honored to acquire and transfer stewardship of the AIDS Memorial quilt and to return it to its place of origin in the San Francisco Bay Area. The bringing together of these two iconic memorial features will ensure that the story of the AIDS crisis will be told in future years. The story of the AIDS crisis is one that's rooted in discrimination, stigma, prejudice, otherism, and a government that chose not to respond. I've been living with HIV and AIDS for over 2 decades. I never thought I would have to live through one pandemic, let alone a second. As we look to the future, it is important that the thread from the AIDS crisis is pulled to the future, especially as today we face the COVID-19 crisis. Over the last 10 months, our nation has been ravaged by this crisis. We've had people stigmatizing and making this pandemic out to be a pandemic that is focused upon certain segments of our population, whether those be individuals from different regions of the world or different age groups or those with other health struggles that they face. If the AIDS crisis has taught us anything, it has taught us that out of those dark days, a community rose up, and out of love, compassion, activism, and resilience, we found hope for the future. Today, on World AIDS Day, we bring together a panel that will pull that thread from one pandemic to another and will share their stories of hope and resilience so that those that are struggling today with their first pandemic will find hope, resilience, and the courage and strength to carry on.
Thank you, John. It has been one of my greatest honors to stand on the front lines with you and so many heroes in the fight against AIDS and for health and social justice. Bringing together leaders from both pandemics makes today an unprecedented opportunity to unite our nation in the face of adversity and empower us to face whatever the future holds. All of us have a role to play in caring for each other, and we've seen that spirit come through so many times, from first responders who put their lives on the line, and quilt makers making masks, to volunteers preparing food and neighbors caring for those in need, people helping people, communities helping communities, coming together in unity on the occasion of World AIDS Day allows us to reflect on how, for 40 years, a community stood up and took action in the face of a government's anemic response to AIDS, and how we take those lessons learned and apply them to today's struggles. Coming together in unity also allows us to see how activism can spark movements of change by demanding social and health justice and the link between other critical issues, such as racial and gender inequality and human rights, along with economic disparities. Coming together in unity allows us to be candid about how these pandemics have disproportionately impacted communities of color, as well as about how systemic racism compounds poor health outcomes and demands more effective solutions. Today, we will have an honest conversation about these important issues in the hope that we will never, ever find ourselves in this tragic place again. Each year, the National AIDS Memorial hosts World AIDS Day commemoration events at the National AIDS Memorial, which is located in San Francisco. Through the generosity of many supporters and partners, including our presenting sponsor, Gilead Sciences, along with Chevron, Quest Diagnostics, Vivint Health, and Wells Fargo, the memorial is able to bring today's event virtually. AIDS and COVID-19 share many things. Yes, they both can affect anyone regardless of sexual orientation, race, ethnicity, gender, or age. But COVID, like AIDS, exploits the range of social, economic, demographic, and racial inequities that make up the cruel underbelly of our society. Any national conversation about pandemics and how to end them cannot ignore systemic racism, as well as the disparities in income, education, and geography. As with AIDS, we are clearly seeing how COVID-19 is also disproportionately affecting communities of color at significantly higher rates. We begin our first conversation today, the impact on marginalized communities, with leaders from around the country who are on the front lines of both pandemics. First, let's hear from surviving voices of the AIDS pandemic sharing their personal stories related to this very important dialogue.
The impact of COVID at this moment is clearly re-emphasizing how unequal this country is.
It's always the people on the bottom who seems to be the most impacted.
Any virus, any disease is going to just run along pre-existing currents of social and economic and gender inequity.
There has always been a conversation, whether it's implicit or explicit, about whose lives are valued and worthy of saving.
The concern about economics over humanity feels deeply rooted in who gets to be seen as a valuable human, right? And this sigh of relief, oh, it's not us, right? Feels very familiar and very similar.
That is a similar narrative to what came up in the early days of the HIV epidemic, around LGBTQ communities, around the lives of people who were using drugs, people engaged in sex work, and certainly Black and brown folks.
A lot of folks weren't paying attention to the epidemic in the early 80s because nobody was talking to us about it. And it was very much presented as white gay.
We've been shouting it from the rooftops with HIV from the beginning of the pandemic. And now we're seeing it with COVID.
Fundamentally, what we're coming down to is some folks are going to have to die so the rest of us can go back to boozy brunch.
From, grocery store clerks to childcare workers, to essential workers, home health care, nursing.
People who don't have homes, people who cannot shelter in place, people who don't have white collar jobs.
Transit workers, people who work in various kinds of service industry, et cetera, which are majority Black and brown folks.
What is also happening with COVID-19, though, which certainly happened with HIV, is it shows up all of the flaws and the cracks in our healthcare system.
So on the one hand, we've thrown a whole bunch of health disparities that communities of color to deal with. On the other hand, we're going to praise them for the essential work that we underpay them for when they're putting their lives online.
Suddenly, we're seeing mainstream media coverage about racial disparities in health.
Reporters who should know better were like, what? Why is that? And I was like, where have you been for 30 years? This is not This is not new. This should not be new. It's horrifying to me that this is new.
And hello, everyone. Thank you so much for having me here and be a part of this incredible, just incredible day, an incredible event. I am TJ Holmes. I am an anchor correspondent at ABC News and co-host of GMA3, the third hour of Good Morning America. And it seems that for the past 10 months that every single broadcast I have been a part of has led with the same story. COVID-19, this pandemic that we are in. But it's incredible how the story has changed so much. If you go back to the very beginning, there was what? A mystery illness. Then there was fear. Then there was death. And then we started learning more about what we were dealing with. And another story that then started to come out is what we often see, is that communities of color disproportionately impacted by the pandemic, disproportionately impacted by the healthcare disparities, not getting the healthcare they need, not getting treatment, not getting access. And yes, it's reflected in the numbers of sick and dead and people who are at the forefront really of this battle and trying to keep cities afloat, but also quite literally trying to keep people alive are the mayors of many of these cities, major cities in the countries who have absolutely been through it and are going through it right now in a whole new wave as the holidays are here. And to get some of those insights, it's a pleasure to have in three mayors who have really been doing it, right? Who have been on the front lines, who have been going at it day in, day out. Joining me now for this conversation, Chicago Mayor Lori Lightfoot, also my mayor, New York City Mayor Bill de Blasio, and Mayor Robert Garcia of Long Beach. We do have, plan to have the Atlanta mayor as well. Keisha Lance-Bottoms had a last minute scheduling conflict, but she did record a message for us, so she is going to be able to give some remarks here at the end. So thank you three, first of all, for being here. And of course, as a news person, I've been seeing you all's faces a lot over the past several months and all this year and the work you all have been doing. But I'm going to start with World AIDS Day first, though, Mayor Lightfoot, and put in some perspective. This day is always a moment to stop, to think, to reflect, to re-engage, maybe re-energize, but put World AIDS Day now in some perspective with the backdrop of the pandemic that we're going through.
Well, it's a great question, and I'll go back to a point in my early history. Years ago, I remember being in New York City for a Pride event, and it was at the height of the AIDS epidemic. And it was early on when I had just come out, and I remember being on a street in New York with a huge swell of parade folks going by, and I think it was ACT UP that was chanting, "How many more have to die?" And just retelling the story now gives me chills. And when you think about what was happening then, where too many government actors were ignoring this horrible pandemic that was sweeping through not just gay and lesbian communities across the country and across the world, but was affecting lots of other folks. And you've then come to this moment where we're facing another pandemic of global proportions. And the way in which the government responds now, let's put aside the federal government, but at least at the state and local level, where we have been all in on the front lines, the difference is profound. And I think the difference really is because of those early AIDS activists who were out in the streets, who were demanding that the government respond to this incredible health crisis. And really, New York City was ground zero for that. And a lot of the things that we have done in our public health response over these last 30 years is really, I think, in some large measure, attributable to the focus and the dedication of those early pioneers who were demanding that the scourge that was robbing people of their lives at such a young age had to be acknowledged and that there had to be a fulsome government response. So I attribute and do a straight line from there to now.
And Mayor de Blasio, as you mentioned, New York City, right? And you don't have to go that far back to remember, right? To remember how people responded and demanded more and better and answers and clarity from their government and response to a healthcare crisis. Where do you put New York City now? This has to be some sort of pride, as she was just there mentioning, where New York City often is at the forefront of getting the responses right. Even if the government doesn't, the citizens at least know how to stand up and rise up.
TJ, such a good point. This is all about the grassroots always. And that's what we saw when the epidemic hit. The people who stood up, and I remember ACT UP and so many other wonderful organizations, people who said, this is unacceptable, it must change. And they were shunned, they were denied, they were belittled. And by the way, even within the community, let's be clear, and I think Mayor Lightfoot would amend this, that to some extent, the voices of people of color were not heard enough. Voices of women were often not heard enough. So even within the struggle, there was a fight for fairness and equality. But what we can say is that struggle changed everything. And what it led to was government finally owning the situation and doing the things we had to do to invest in reaching people, educating, providing, testing, all the things. Doesn't this sound familiar? You know, reaching the grassroots, educating people, getting testing to them. Well, finally, it started to happen with HIV and AIDS, and it's made a profound difference. And what I've been blessed to be able to see in my 7 years as mayor is that we can say the words end the epidemic and mean it, that we can actually work toward the day when HIV and AIDS doesn't afflict anyone. You know, that's a believable concept now, which would not have been in the time that Mayor Lightfoot is describing. I remember it like it was yesterday. It felt like a horrible plague that could last for generations. The fact that today we can say the words end the epidemic and mean it is a testament to the fact it can be done at the local level. Now, finishing the point though is the national level. I remember during the Reagan administration, the inability to acknowledge the AIDS crisis. And unfortunately, in this era, the inability in the current administration for so long to acknowledge the depth of the coronavirus crisis. So we've come a long way, TJ, we really have, but there's something we still have to get right in this country, which is the best way to fight a problem is to say it out loud, acknowledge it, and then go to the grassroots where the people are and make a difference.
Mayor Garcia, picking up on his point there about there was a time we used to talk about how many people were dying from HIV/AIDS, to the point that we are now talking about how many people live with HIV/AIDS. Coronavirus now, there has been an evolution of this thing throughout the year, but there are still some people who, I'm surprised at how many studies and surveys are out there that talk about how many people do not plan on getting the vaccine once it comes out because they have some kind of fear about the vaccine. They don't trust government. And a lot of those numbers are higher among communities of color. How are you handling your community and your diverse community and making sure they trust what you're saying, getting that message out, a message out about the vaccine, a message out about taking care of themselves that can literally save lives? And they need to make sure, Mayor Garcia, they trust you when you step to that podium.
Well, thank you. I think the first part of your question is really important. I want to think the one thing that's really, I think for me and for so many others in the community, the fact that people are living with HIV and they're living full lives, and that stigma has been reduced so dramatically, I think is really, really important. And I know that for the dignity of those that every day wake up, that reduction of stigma has been such an important part of the fight that the other mayors have been talking about. And they are our brothers and sisters and part of our family every single day. As it relates to COVID-19, and I think that HIV was an epidemic before COVID. It's going to be a part of an epidemic after COVID that we'll have to deal with, and the two actually have a place where they meet, and there's folks that are struggling with both. We have to understand that we have to get serious about the virus today. And so for me, I earlier this year lost my mom and I lost my stepfather to COVID-19. And I try to use that experience, even though sometimes it is hard and painful. I try to use that experience when I'm talking to our community about how serious it is, and that even a healthcare worker, like my mom, who wore PPE and took care of herself and has been in the medical profession for 25 years, if it can happen to her, it can happen to anyone. And so when we're out, I think it's important for us to understand that all of our communities, particularly communities of color, receive messages different ways. And I've tried to ensure that we have our messaging around vaccine preparation, which really the mayors are going to be on the front line of vaccine distribution in our cities, that we're reaching to people in their languages, that we have culturally appropriate messaging, that communities of color understand that while they have maybe feared their federal government for many years, that we're trying to turn the page and really reach out in a way that they understand. And so we're creating programs right now that are going to target undocumented communities, communities of color, Khmer speakers, different languages, all the languages that we speak across this country, to ensure that people feel good about the vaccine, that there's education in place, and that they're hearing directly from us mayors as well.
And Mr. Mayor, I want to follow up with you there, and I know you've talked about it publicly, and I hope you don't mind me asking here. But your mom, right? This in your family, did that? Our ABC, our medical correspondent here, Dr. Ashton, who's been a part of these conversations as well. She always talks about, people say, "Oh, the chances are so small of me getting it," but then once somebody gets it and dies in your family, the chances are now 100%. So we don't need to be looking at it and well, it's my chances of getting it. That's not it. And I'm asking, when it comes to your family, your mom, did something about your view of the pandemic, of this virus, did something about you change, even change in how you decided to govern, to communicate, to speak to your community about it?
100%. I mean, I think I always took the pandemic seriously, but you never think it's going to happen to you directly. Within a span of 2 weeks, I had lost both of my parents, and I think that hit me in a different way, and it really strengthened my resolve to protect as many people as possible, and not wanting anyone else in the community or the country, quite frankly, to go through what I had to go through, what my brother had to go through. And it is serious. This idea that it can't happen to you or it can't happen to your family is just completely false. It can happen to anyone. And so that has been something I think that I've tried to also use their story as a way of encouraging folks to test, to stay safe, and now to get a vaccine.
Mayor Lightfoot, something I'm sure you've heard it before, and it's said around dinner tables plenty, and maybe it's not said a whole lot on network news. When white America gets a cold, Black America gets pneumonia. That's something that's been said for a long time, and the point there being, we are always disproportionately impacted, communities of color. What have you seen there in your city? This became a story several months, right? They started focusing on it several months after the pandemic. What are you seeing there in your city? And is it changing in some way? Is this going to change and finally get us to close those gaps, close those disparities when it comes to healthcare?
Well, first, let me extend my condolences to Mayor Garcia. I can't even imagine going through such a personal loss in the middle of this and still being called upon to lead and really set the moral example for your city. So you have my sincere condolences. And look, to answer your question, I think what this pandemic has shown is the healthcare disparities, the life expectancy gaps that we all know about, particularly as mayors of urban cities. Those have just been accentuated that much more because of COVID-19. I remember back in April, the pandemic really hit our city in mid-March, but in April when we finally started to see the data, and at that point that African Americans in my city were dying at 7 times the rate of any other demographic, it literally took my breath away. And it becomes personal very quickly, right? I have an elderly mother. I have siblings who have the same kind of comorbidity, underlying health conditions. And we know that this virus attacks with a ruthlessness that really we haven't seen in any other circumstance. So it becomes personal. But I also knew that what we needed to do was provide individuals and communities with solutions. So we stood up a racial equity rapid response team. And while we've learned a tremendous amount since then till now, those disparities that are at the heart of the challenges that we're facing in Black and Brown Chicago and Black and Brown New York, Black and Brown Long Beach, I'm sure as well, in other cities, they have not disappeared. But what it has made us do is have a resolve that we are not going to look the other way, that we are going to accelerate the work that needs to be done to heal these communities, to reach them, to educate them, to bust through the myths about the government and the healthcare system, and really meet people where they are. We're doing that now. We've got people out on the streets in the zip codes and census tracts that have the highest levels of positivity to go literally door to door with education pieces in multiple languages and say, we're here to help. We're here to help you. And really, again, bust through the myths and the skepticisms that people naturally have about government and the healthcare system that unfortunately, because of what our current president has done at the national level, has just been exacerbated. But as mayors, we know that we can't sit idly by while our residents are suffering. We're worried right now, based upon our modeling, that if we don't do more at the local level in Chicago, that we're going to lose another 1,000 Chicagoans to COVID-19 by the end of this year. 1,000 more. That's over a third of what we've seen for this whole year. That's how serious this second surge is. So it is an all hands on deck moment for us. Every single day, we are driving hard and deep in these communities, people that come from other countries, that speak a different language, but they are residents of my city. I have a responsibility to them.
Mayor de Blasio, you heard Mayor Lightfoot talk about busting through myths and skepticism. That was exactly what had to take place during the AIDS pandemic, right? Or the exact same thing. And it may have even taken a little longer, right? We've learned a whole lot here in 10 months. It really took us years and years to really nail down what was going on maybe in that pandemic. I had a routine here in New York, Mayor de Blasio, every day. 9:30, watch your briefing. 11:30, watch Governor Cuomo's briefing. 5 o'clock, watch the White House briefing. And I got different messages and different smackdowns and different ways you all were kind of doing to each other. And it caused a lot of confusion. People didn't know who to listen to, who to trust. Yeah. And so to Mayor Lightfoot's point about the skepticism and myths, some of our leaders, local, state, federal, feed into or act fueling some of that skepticism. How are you supposed to now get people to listen to you or tell them who to listen to? How do you now kind of bring down that skepticism at a time we need folks to start taking a vaccine and staying home and not traveling for the holidays?
It's a really powerful question, TJ. And I also just want to first say my condolences to my brother, Mayor Garcia, for everything he's been through. And, you know, Ken, I don't know how you keep going. God bless you, brother. But to your question, TJ, look, actions speak louder than words. We have all of us had a challenge because we can't align with the federal government. Let's just be honest about that. I went through the Ebola crisis with President Obama as our leader when I was mayor, and it was night and day. You know, when you could be in total unity with the White House and get, in fact, leadership and support and clarity from the White House, it's an entirely different situation. We just didn't have that. So let's be honest about, we couldn't wish that into existence. But I agree with you, TJ, for all of us, we have to do everything we can to get a clear message out to people. And I think the best way to do it is on the ground. Mayor Lightfoot just said something really powerful about how she responded to the disparities. When you tell people there are disparities openly and honestly, it actually breeds trust. We were very blunt when we saw those disparities come out. We were very blunt about the folks we were losing who weren't in the official death count. But we said, this is what's happening. We got to be honest about it. And then we went to the grassroots. We created a huge test and trace corps, almost 5,000 people now, and it was hired from the communities most affected. And that's crucial, TJ. People are going to be cynical if they don't see their own communities represented. We created something, Chicago and New York on very much the same page. We created a task force on racial inclusion and equity to move resources right now to 27 neighborhoods in the city that were most deeply affected by the coronavirus. But let's be clear and blunt, TJ. That was not your garden variety governmental task force. The only people on that task force were leaders of color in this administration. Latino, African American, Asian leaders. And we wanted to make very clear to communities that the leaders who represented them and served in city government were determining where resources would go. And we're doing things that would have an immediate impact. We made major changes right away, not only in terms of healthcare, but in terms of small businesses, policing, things that people could feel right away. And I really believe there's tremendous cynicism, TJ. There's tremendous doubt. And you're right, it's exacerbated by differences among leaders. But in the end, if people actually, for example, we said in the city, no New Yorker go hungry. We said we would make free food available to anyone who needed it. We deliver it. If it's a senior who couldn't get out of the house, we deliver it to them. When people saw that actually happening, it gave them some faith. When they needed PPE and they could get it, it gave them some faith. These are the things that actually build some trust. And this is what cities have done despite all the odds.
And trust is probably the best word to put out there. And Mayor Garcia, on to this idea of momentum, we're talking World AIDS Day, 40 years. And again, if you ask most people on the street, they would tell you maybe we have this under control, even though there are, of course, so many millions that are living and thriving, as you said earlier, living with HIV. We have only 10 months into this here in the US, possibly a momentum issue with COVID. Because there's this COVID fatigue you keep hearing people talk about. Then we got to the summer and everybody thought maybe it'll just go away. It's summertime. Now here we are on the holidays and people are just over it. I'm going to see my family. I don't care. And now the message of a vaccine is coming, which also might cause people to get their guard down. Okay, help is on the way. We're good to go. What is your messaging now, and in particular to communities of color, that this is not the time to let your guard down?
I mean, I think that's absolutely right. And I think, both of our other mayors on this call will attest how frustrating it is right now to see what is going on in all of our cities. We are seeing out here in California the same spikes and kind of irresponsibility that is happening out in the public. And I think we understand that people are tired and there is fatigue in place. But we're breaking out here positivity cases. Our climb on hospitalizations right now is higher than even when the first spike hit out here out west. And so I think we're all dealing with that COVID fatigue, but we've got to be stronger. And the one thing that I've told people, particularly young people who are now driving a lot of the new cases, is taking on this virus is about being brave and about sacrifice. And if we can't take throughout this winter and holiday season, just sacrifices and not seeing our family and not traveling, not gathering in large groups, then we're failing not just our own family, but we're failing our country and our community. And so I think it's particularly important for young folks to be able to look in the mirror and say, what am I doing to actually save lives and make the conditions for my grandparents and my parents and my community members a better place. And I think sacrifice is the key issue right now. We should also be looking, and as we are discussing World AIDS Day, the immense amount of strength and courage the activists, those that marched, that fought, that stood up to government, that put HIV and AIDS in front of folks, anyone that would listen, for decades to ensure that we would take on the virus in the way that we have. That level of courage is what we should be modeling today, especially with young people. But we've got to do a lot better, regardless of where the vaccine is. And that may not hit the general public still for many months into 21.
Mayor Lightfoot, how do you strike a balance between saving a life and keeping a business open? This is what so many mayors are dealing with, and you all are getting criticized no matter what you do and how you do it. But what goes into making, for you, that decision between And maybe it's not even the right way we look at it, even though we do sometimes. Do I save a life or do I keep a business open? What goes into that decision making?
Well, it's always going to be guided by the public health guidance. This has been an extraordinarily difficult time for many of our businesses, particularly in the hospitality, restaurants, bars, hotels, tourism. All of those businesses have been dramatically impacted by the COVID-19 induced shutdowns. And many of them are closed or hanging by a thread. But the dialogue and a partnership that we've had with those industry sectors, and particularly our small businesses, to listen to what they need, to connect them up with resources, but also just to have that partnership to a business leader. They understand, they may not like it, but they understand why we always have to put the public health considerations first and foremost. Because if we don't save lives, if we don't protect them, and we don't protect their employees, we don't protect their customers, there will be no business. And this has been very, very hard. Balancing it is not easy, but the call and the right call that I think all of us have made is we've got to protect lives. That is our solemn obligation and oath as leaders in our cities. We've got to put saving lives first. And that's why we have done what we've done, even though it's created hardship. We try to mitigate that with some economic resources. We put together all in this year about $150 million in grants and loans, some of them targeted at our micro businesses. We always have a social equity component in anything that we do in distributing government resources. I'm proud of the work that my team and I have done, but this is a very difficult season. You think about the fact that we're in the fourth quarter of the year. You think about bars and restaurants and the hospitality industry. This is a quarter where they make up any downturn from the rest of the year. And yet, unfortunately, many of them are seeing historic worst months and weeks in this fourth quarter. It's a very, very tough thing for them. And I'll say what I know is on the mind of my fellow mayors that are on this call. We've got to have federal stimulus relief. It is unfair for our businesses to do the right thing, to close, to have all these additional expenses related to mitigation and not have the federal government step up and help them. No mayor, no governor has the kind of discretionary funds that can really mitigate the economic harm that has been visited upon our businesses directly as a result of COVID-19. Our budgets have been directly impacted by COVID-19. We just voted on a budget for 2021 yesterday, closing a $1.2 billion deficit, 65% of which was COVID related. So the federal government has to step up and bring relief to our cities, to our businesses and industries that have been dramatically impacted. And I will say this too, to our workers. Part of the challenge that we're seeing, and I know this is true across the country, is so many workers who depend upon their paycheck to live, to buy food, to have shelter, don't have a cushion, don't have a savings, are every single day thinking, I'm worried that I may be sick. I may have the virus. I'm pending a test result, but I got to go into work because if I don't work, I don't get a paycheck and I can't eat. We should not be putting essential workers in that kind of Hobbesian choice where they have to choose their income over their health and the safety for themselves and their families. So part of the relief package that must come is a fund for cities to be able to pay people to stay home when they are sick.
Last couple of things here, and Mayor de Blasio, I'm going to pick up on a couple of things she said, and I want to actually end. We kind of do a roundabout with all of you with a message of hope as we're moving forward. But Mayor de Blasio, just kind of on what she was saying about the federal government and needing help. And again, I know this so well because I was watching you every single day saying we need help, we need help, we need help, and it wasn't coming quickly enough or it wasn't coming at all. But do you get a sense that mayors, Mayor Garcia, Mayor Lightfoot, Mayor de Blasio, and your cities, that you have kind of taken on this position of we need to take care of ourselves. The cavalry ain't coming from DC.
Yeah.
We wish it was coming, but it's not. So have you seen your city be resilient in a way and people come together to where this is painful, but you know what? We got this. We have to take care of this ourselves. We'll get the help from them if it comes. You're going to need the vaccine and some things you have to get from the federal government. But have you seen your city kind of step up and proud of it in a way because of what may not be coming in terms of the cavalry?
Yeah, TJ, one of my great mentors, our former Deputy Mayor Bill Lynch, used to say, God bless the child has got their own. And we in this city, we have to take care of ourselves. And I think this unites the two crucial things we're talking about here. When you think about World AIDS Day and the lessons we learned, the fact that the federal government was not there, was not present and accounted for on AIDS for years. And oftentimes cities were slow. And then the people, the activists called out the cities. And it was many times cities like New York that finally took the responsibility and protected their own people long before the federal government came on the scene. We've had a repeat now with the coronavirus that we had to fight for months. We didn't have testing. We didn't have the tools. We had to find a way to fight back. I'm happy to tell you today, we're celebrating 1 million New Yorkers have been tested since this began, and the numbers are rising all the time. So we finally are getting some of the tools we need, but we had to create a lot of that ourselves. And so, yeah, in the end, what this whole crisis has said, probably more than any previous crisis, is cities have to defend our own people. We cannot believe in our federal government as our savior. We hope and pray they will show up. But in the meantime, we're going to fight for our own people. And a lot of times the very best solutions are at the grassroots. If you can build that trust with communities and show you're going to get something done and fight those disparities, people will believe and people engage, and that's how we protect ourselves.
And Mayor de Blasio, I'll stick with you to kind of end on, and I'm going to ask all of you the same thing, kind of the message moving forward of hope of one, when we might be coming out of this thing. And also, like you mentioned earlier, Mayor de Blasio, with the AIDS pandemic, we know we can end these things. So if you can take all of you maybe a minute or so to just kind of wrap it up with a message of hope and how we know we can turn a corner.
Yeah. Look, on World AIDS Day, we remember all those we've lost, but we also really, really take stock of all the people who fought back and all the people came together. And now the fact that we are ending this epidemic, something that would have been unimaginable years ago with HIV and AIDS. Well, now with coronavirus, we're fighting back and we're showing incredible resiliency, and it will be over. By next year, we will be living in an entirely different and better reality. We got to fight our way to next year. And never get so fatigued as to forget the fact that if we just stick with it, next year we get to feel the freedom, we get to turn the page. And the simplest way I can say it is this Thanksgiving, our tables will be small. There won't be a whole turkey maybe. There won't be everyone you want there. Next Thanksgiving, we're all going to be together again. Next Thanksgiving, we're going to have overcome the coronavirus and gather together in joy.
All right, Mayor Lightfoot.
Well, I think you hit the nail on the head when you talk about hope. I think one of the most important things that we can do as local leaders is really inspire hope in our people. And what we've seen over the course of this year is just a tremendous amount of sacrifice, people rising to the occasion, both in and but particularly outside of government, feeding the hungry, making sure that people are connected to medical services. And what I've said to my team is, I don't want to build temporary scaffolding. I want to build a foundation on which we can solve these disparities once and for all. Bill's 100% right. This is within our reach. This is within our power, and we can absolutely get this done. If we see this pandemic as a once-in-a-lifetime opportunity, and I think it is, despite the hardship, despite the pain, there's so much good that has come out of this already, the creativity, the innovation, and remembering truly that we are each other's keepers. I talk a lot in my city about hope and love and not forgetting that we are each other's neighbors. And every single day, there's another story of somebody really rising to the occasion. So as we end this very difficult year, heading into 2021. I think we draw upon and lean into all of that positive energy that has been generated even in this very difficult time.
All right, and Mayor Garcia, I'll have you bring it home for us.
Yeah, I mean, I would just add that first, I think as we think about and remember everyone that has left us because of HIV and AIDS. For me, as a gay man, it means an enormous amount knowing the amount of sacrifice that's happened within our own LGBTQ+ community throughout this a terrible virus and the damage it's done to our community, to friends of mine, to people and mentors that I look up to and to respect. And it reminds us that we have to be strong because things can get better. And that's the case with this COVID-19 pandemic. And I'm very hopeful, like the mayors before me, that a year from now, we're going to be gathered around with family, around tables, laughing, enjoying each other's company. I am very hopeful that if we stay strong in this moment and sacrifice, that next year we will all have those vaccines in our systems and be healthy, and most importantly, have learned an enormous amount so that the next crisis or the next pandemic will be ready with a better plan and a really united front within the community to really share love and support throughout any future challenges that we might have. So I'm very, very hopeful and grateful this holiday season.
Oh, Mayor Garcia, you are a heck of a story. I will add to the comments from the other mayors as well. It's just remarkable given what you've gone through and to keep going, not just to keep going to work. You are doing some incredible hard work in the midst of a pandemic that took people you love, people you are closest to. So that you are sharing that pain and still working through it and trying to save lives is just commendable. So really, thank you so much for what you're doing, Mayor Garcia, Mayor de Blasio, Mayor Lightfoot. Thank you all for this incredible conversation. I know I'm going to see you all plenty down the road as we keep covering this pandemic. And yes, maybe I swear, I want to come to all of you all's Thanksgivings next year. I'll find a way to get to Chicago and to out to Long Beach. And Mr. Mayor, I'll see you downtown here in just a little bit. Anyway, all right. Well, thank you all so much. And we do want to now like to introduce Atlanta Mayor Keisha Lance Bottoms for a few remarks.
AIDS Day is a day to remember the millions of lives we've lost to this dreadful disease. And it's also a day to recommit ourselves personally and on behalf of cities across this country to making sure we are doing all that we can do to provide the resources and education to help stop the spread of HIV in our communities. While public health policy technically falls under the purview of our county, I recognize that as mayor, it's all of our responsibility to make sure we are doing everything that we can to make sure that our citizens have access to basic health care. It's part of the reason that we appointed a chief health officer in our city to help coordinate with our partners at the county level and at the state level. We also, for the first time, allocated $100,000 in our city budget to help combat HIV and AIDS in the Atlanta community and to help administer PrEP to our communities. We also declared racism as a public health emergency and are in the process of formalizing a report that will study many of the inequities, structural inequities that lead to disparities in healthcare and health treatment throughout our communities. So whether it's emotional wellness, whether it's physical well-being, whether or not it's access to healthy fruits and vegetables in our communities, we recognize that it's something that we have to all work on and make sure that our communities are healthy and whole.
Have you ever noticed how our busy lives come to a halt when our health becomes a concern? The only thing that matters is finding the answers we need. Illuminating those answers is what Quest Diagnostics does best. Our lab tests deliver accurate results that shed light on the necessary steps toward better health. We call it Action from Insight. That's taken on a whole new meaning with COVID-19, which is why our lab techs, couriers, pilots, and other committed employees are working around the clock to bring clarity to all the uncertainty. We mobilized early and leveraged our size to meet the needs of our country. And we continue to do our part by processing an extraordinary number of tests. All of this means more answers in the hands of patients, healthcare professionals, and those who need them most. Now more than ever, every answer counts. Not only for us as individuals, but for our communities as well.
That's why in 2020 and beyond, we're taking it a step further. Today and every day forward, we are taking a stand for health equity. Quest has pledged to join the fight to reduce health disparities in underserved communities through a more than $100 million investment to expand access to testing, partner to help those hit hardest by COVID-19, and drive local health education and engagement to help all people get the information and access they need to be healthy. We stand with you as longtime supporters of this community and the fight against AIDS and HIV, and we will continue to be here to inspire action and deliver not only the results needed to make the best decisions for your health, but also a steadfast commitment to create healthier communities across the country.
Now it is one of my deepest honors to introduce one of our heroes in the fight and a longtime friend of the National AIDS Memorial, House Speaker Nancy Pelosi.
Hello. It is my privilege to send warm virtual greetings to the extraordinary leaders and advocates at the National AIDS Memorial Grove's World AIDS Day Forum. Thank you, John Cunningham and the National AIDS Memorial Grove, for your tireless leadership and years of committed advocacy. Congratulations to today's National Leadership Recognition Award honorees, Dr. Anthony Fauci and Dr. David Ho. Their lifelong work has had a transformative impact on our efforts to care for those living with HIV/AIDS and to end the scourge once and for all. On World AIDS Day, we remember the beautiful souls lost to this terrible epidemic and recommit ourselves to the ongoing urgent work of sending HIV/AIDS to the dustbin of history. Over the last 40 years, the energy and activism of survivors, friends, and allies has advanced remarkable progress, helping pass the Ryan White Care Act, increase funding for research, strengthen investments in prevention and care, and establish PEPFAR and the Global Fund. And through it all, this mission was blessed by the visionary leadership and allyship of the conscience of the Congress, the late John Lewis. John was a fierce defender of equality and civil rights who recognized the importance of standing up for the rights and dignity of all, regardless of who you are and whom you love. It was particularly inspiring to see John part of the introduction of the Equality Act to end discrimination against the LGBTQ community once and for all. John always fought tirelessly to overcome the discrimination and the enduring stigma faced by those living with HIV, to end persistent and dangerous disparities in access to treatment and the funding needed to finally find a cure. As a representative from Atlanta, John felt immense pride that his city served as caretaker to the AIDS quilt for nearly 2 decades. We're all so happy that he was with us last year to celebrate the quilt's return to its new permanent home in the Bay Area under the exceptional stewardship of the National AIDS Memorial. In everything he did, John worked on the side of the angels, and now he is with them. But his legacy remains a powerful inspiration as a new generation of activists and leaders continue his vital work to advance justice, pursue peace, and secure a brighter future for all. On behalf of the United States Congress, May this World AIDS Day renew our commitment to continuing John's work and to achieving the dream of an AIDS-free generation. Thank you.
Thank you, Speaker Pelosi, for those inspiring words and for honoring the late John Lewis. His voice still rings loudly today and leads us to our next conversation, activism that sparks change and movements. Recent events remind us of the power of activism, the rights of girls and women, Black Lives Matter, LGBTQIA+, and voting rights, to name a few. Activism at its core refuses to accept the status quo, for it is from our individual and collective actions that we bring about change. For over 4 decades, we have risen up in the fight against AIDS, which is constantly renewed by an ever-growing span of generations who have followed in the footsteps of those who have gone before them. Whether it be ACT UP, the AIDS Memorial Quilt, or volunteers making masks, these selfless acts inspire the next generation to improve the lives of our fellow citizens and the communities in which we live. It is in this vein that our next conversation brings together individuals who are change makers, leading powerful movements. But first, we hear from Chevron, followed by voices from the AIDS pandemic and our panel discussion.
Thank you to the National AIDS Memorial and the esteemed speakers participating in today's program. This further inspires us and sheds light on the critical need for us all working together. I'm Mike Steinberg, Team Lead for Global Public Health at Chevron. Whether we say activism, advocate, supporter, or values, we feel all entities and individuals have a role in standing up for and engaging in initiatives and opportunities that are meaningful for them and align with their core values. At Chevron, our history of workforce and community health programs, partnerships, and investments is something we're very proud of. Many examples date back to the beginning of the AIDS epidemic, when we began workforce training, developed a global HIV and AIDS policy, and engaged with partners to develop education and awareness tools to combat stigma, misinformation, and discrimination. Sadly, many of these same issues are in the forefront of the current pandemic, and we're once again putting our resources and experience forward. Throughout past responses, we've also seen many symbols, like the National AIDS Memorial Quilt. Our quilt story, inspired by Cleve Jones, began in 1993 when a group of Chevron employees started making blocks to commemorate colleagues who lost their lives to AIDS. We also proudly have 2 Chevron quilts in the Care of the Names Foundation and are part of the Memorial Quilt. Our own quilt project continues to be one symbol, a visible, impactful symbol for education, remembrance, hope, and solidarity. Each year, a group of employees carries on this legacy by creating a new Chevron quilt. You can see one from a couple of years ago behind me. This year's quilt embraces the theme of resilience, a theme we're all continuing to build individually within our systems and organizations. Our commitment to workforce and community public health, past, present, and future, continues today through these symbols in our programs, community engagement initiatives, and investments. Regardless of how you engage, support, or advocate, I challenge us all to continue to take action towards positive change. This power of engagement and strengthening our resilience will lead us to stronger, healthier, and more prosperous communities. Thank you, and stay healthy and safe.
I give a lot of credit to what the HIV activist community was able to do all those years ago. You know, with ACT UP throwing blood at the FDA and all the rest, it changed the way our government reacts to new drugs and new protocols and public health in general.
We're dealing with a public health system that looks nothing like the public health system that we had 40 years ago.
In terms of, epidemiology in the CDC and, the sort of that level of public health, but then also drug development.
Everything from fast tracking drugs, using off-label drugs, using physicians' networks to be able to do comparisons of the thing. All of that was modeled in the AIDS epidemic and is now being applied very quickly in the COVID epidemic.
It took 4 years to get an antibody test for HIV. It took 4 weeks, maybe a few more weeks than that, to get an antibody test for COVID.
The kind of transnational data sharing of scientists in real time of like what's happening, a lot of that was created because of the AIDS movement.
I don't think any drug company will ever get away with again making a drug so expensive that poor people can't get it.
And I think we're seeing that as with COVID, and people demanding access to testing, as well as access to medications and treatment, and ultimately an access to a vaccine.
All of that is AIDS movement like wins that is being brought to bear right now.
I think that we did lay the foundation, but no one's in a position to be able to do what we did.
One of the big differences between my experience of AIDS and my experience of COVID is that I'm so isolated now.
Being locked in the house has a horrible impact on our ability to be heard in all this.
I think there's a combination of grief, rage, frustration, because we can't just take to the streets. And so we need to find new ways of mobilizing and organizing.
The digital equivalent of getting people in the streets, or the digital equivalent of saying no business as usual until something is addressed. It's certainly something that I've been thinking about a lot, but I don't really have a response to that yet.
Granted, we now have the internet and we didn't, but a bunch of posts saying I disagree with is not quite the same thing as marching on City Hall.
You can't get into Grand Central and hang a banner when it's empty. You can't put a condom over Jesse Helms' house anymore. It's going to take a younger, smart thinker to get us out of this the way it took Larry and Peter and all those other people to get us out of HIV/AIDS.
Hello, I'm Alfonso David, President of the Human Rights Campaign. I'm honored to be here today on World AIDS Day to serve as a moderator for this important discussion on activism that sparks change and movements. Joining us today are three powerful voices, leaders of movements that represent communities that have been marginalized, movements that challenge the status quo and change the public discourse, movements that brought people together for change through civil protest, electoral mobilization, and community building. HIV/AIDS, Black Lives Matter, LGBTQ+ rights, COVID-19. Through these lenses, the activists joining us today have been on the front lines, demanding change, demanding action, and transforming our cultural landscape in the process. I'm pleased to welcome with us today Alicia Garza, founder of Black Futures Lab and co-founder of Black Lives Matter Global Network; Cleve Jones, author, activist, and co-founder of the AIDS Memorial Quilt; and Kirsten Urquiza, co-founder of Marked by COVID. Thank you all for being here today. So, to begin the discussion, I will pose this question to each of you. When you think of activist influencers, where do you draw your inspiration from? It can be from an individual or a movement, past or present. Why don't we start with Alicia?
Hey, it's so good to be here with everyone. You know, when I think about an activist or an influencer who kind of lights the way for activism today, I always say the same person, which is Harriet Tubman. Harriet Tubman is a regular person who could not stand to endure being enslaved any longer. And so she escaped. But she didn't just take care of herself. She went back for her family members and ended up shepherding hundreds of people out of enslavement and towards freedom. And the reason that I hold her up as what I call my patron saint is that she endured a lot of hardships along the way. In fact, her heart was broken over and over again, as sometimes people who said they wanted to be free actually were not yet ready to do so. Her brother, her husband, right? Her sister, who she went back for, and it ended up that she was dead by the time that she reached her. These are stories of somebody who, against all odds, continued to fight, not just for herself, but for humanity. And so she is someone who I always try to hold up and emulate as much as possible in terms of endurance, dedication, commitment, and a spirit of what it means, right, to belong to each other and to be responsible for one another.
Thank you for that. Kristen?
I am so excited to be here. Thank you so much for including me. And I have to be honest, two of the people that I uphold very high and as activists are Cleve and Alicia. I'm a COVID activist. And part of what drew me into activism after losing my dad was seeing around me that this was both a viral issue that had similar roots to the AIDS crisis, but also a racial justice issue. And looking at both the activism of Black Lives Matter and Alicia and the AIDS activism of Cleve and so many others is really what was the foundation that gave me strength to trust in myself and raise my voice. So I'm very honored to be here with both people that have inspired me throughout the course of my life in the last 10 plus years.
Wow. Why don't we turn to Cleve, one of the inspirations for Kristen?
Well, that's very kind of you. I'm not a religious man, but I grew up in the 60s. I was born in 1954, the year the French army was defeated in Dien Bien Phu and the U.S. involvement in Vietnam began. So that war continued throughout my childhood, all through high school. It was still going when I got out of high school and moved to San Francisco. And during that period, I was profoundly influenced by the Society of Friends, also known as Quakers. My mother took me to Quaker meeting, mostly to make sure I could avoid the draft. But I was very moved by them and very influenced by them, and in particular, their commitment to social justice. And if you've ever been to a Quaker meeting, they worship in silence. There's no clergy, there's no sermon. And the people in that meeting were very quiet, self-effacing people, but they'd been on the front line of so many struggles. The Society of Friends were the first to treat women as equals within their meetings, champions of the civil rights movement, part of the Underground Railroad, the anti-war movement, one of the first denominations to begin marrying same-sex couples. And I was just struck by their commitment to live up to their principles, and including the willingness to go to prison if necessary in opposition to the war. So again, I haven't been to Quaker meeting in a long time, but I still hold those values very close to my heart.
So the three of you have been engaged in activism, and you do that in a variety of different ways. It appears as though traditional forms of activism has lost value. With social media and the diversity, the breadth, and the speed with which information is now shared today, how do you personally use those channels, the new channels that we're talking about, to drive change and to drive action? Cleve, why don't we start with you?
Well, I'm the oldest person here, so probably the least proficient with social media. And I have some frustrations with it. But I do my best, and I'm grateful for its ability to connect us. But I'm very wary, because I think just as much as it has the power to connect us, it also, I think, has a very distancing and isolating quality for some people. I also think it's important that traditional forms of activism and organizing not be lost. And particularly after this last election, I work for a labor union. I work for Unite Here International Union, which represents hospitality workers in the United States and Canada. Most of our members are women. Most of them are women of color, immigrants, refugees from other countries who fled war, poverty, famine to give their kids a better shot at life. And we have maintained very traditional organizing tactics, storytelling, face-to-face, reaching out to bridge the gaps that are so, the divisions that are so exploited often by the bosses. So for our union, yes, we use social media, but we also really rely, I think, far greater on old school face-to-face eye contact, worker to worker, sharing stories, finding common ground, and building solidarity to take on some of the really extraordinary challenges that workers face today.
And Kirsten, why don't we shift to you? You are probably the newest member to the family of formal activism. How are you using social media or the new ways of sharing information, using the new channels to drive change and action?
Sure. I mean, COVID has put incredible constraints on how we are comfortable getting together and what is actually safe. And so social media has actually been an incredible tool in our activism for really helping to connect with people all across the country who are experiencing incredible loss. I, over the course of the last 5 months, have met people from all corners of the planet who are doing a lot of incredible work that we've met through, Twitter direct messages to Facebook direct messages that we've then created private groups together to begin to mobilize and strategize on how to bring COVID activism to an offline, in their local community. And it's really been like a major database in a way to find folks who are experiencing incredible COVID loss and struggle, and then using sort of the strategic thinking of how do we, across different backgrounds, different geographies, different localities, work together to support one another. And as a result, we've been able to organize marches in places across the country. We've been able to organize vigils. We've been able to host strategy calls across generations and time. And it's all been through finding one another, connecting, and building community around our collective losses, using the tools of social media and continuing to kind of push out our message to find more people to continue to build the group. But I also agree with Cleve that I think it's not one or the other. I'm a big proponent of the hybrid model of using social media tools and offline tools to really kind of build out the message, build community, and then figure out ways in which to take that energy, out into the world, in the real world, whenever it is safe, and there are the precautions that you can take to make sure that folks are safe.
Alicia, when you started, social media was in its nascent stages, and now social media is everywhere. How has it changed for you in terms of affecting change and engaging in effective action?
You're so right that, I grew up with social media in a different way than a lot of people of this generation have. I'm a Zennial, and so I had an analog childhood and a digital adulthood. And, I think that for every generation, there are these kinds of monumental shifts that take a lot for people to get used to. And I'm no different. I agree with both Cleve and Kristen that ultimately, what is important is how we build relationships between real people, not between avatars. And unfortunately, one of the challenges, I think, of social media that has really broken down barriers between people, whether it be geographic barriers or even just exposure barriers in a deeply segregated world. Part of the challenge here is that these platforms encourage us, right, to create personas that don't exist in the real world. And so one of the things that we have to do to challenge that, I think, is to remind ourselves that building power and building movements is about putting more power into the hands of more people, but it's also about connecting people across difference. It's about connecting people who, are unlikely allies in a larger struggle for freedom and justice. And the way that I think social media can play into that is number one, by us remembering, right, that we don't own these platforms and that ultimately, these platforms have been created, yes, to connect people, but they're also very much created to generate profit. And there are lots of harms that communities can experience on these platforms at the same time that we're using them to connect. The other thing that I think is very, very important is that, I agree 100% with Cleve that while there have been so many important advances with social media, it can also deeply isolate and deeply divide people. And that's about people's behavior and what people do behind these avatars that we create. So I don't want to throw out the baby with the bathwater and say these platforms are not useful. And I think for myself, as somebody who didn't even know what a hashtag was, right? When we started Black Lives Matter, I was like, this is a pound sign. What is the pound sign doing in front of my words? But at the same time, I have seen how the avatars that we create can be used to bully or punish people for having different opinions, having different thoughts, having different practices and ways of life. But in essence, that's not the fault of social media. That is deeply embedded in our society. And we are taking those behaviors and we're putting them on technical platforms. So for me, I think the best use of social media is to be able to follow conversations that are happening around us that we might not physically be able to participate in. But I also agree that one of the things that I think we've tried to do better over the last 7 years is use these platforms to connect each other around the things that we care about, around the things that keep us up at night and wake us up in the morning, but also that we use those relationships that we're building online and translate them into action offline. That's why I think this panel of people is so important, because each person here has been doing that work for not just a very long time, right? But doing it effectively, using these tools that, frankly, have a lot of complexity to them.
Well said. Now, people, of course, know your work. Many people know what you do. I want to go a little behind the curtain for a moment and talk about how you got here. We all experience loss in our lives, but all of you have experienced loss in a truly unexpected and somewhat deeply troubling way, whether as a result of pandemics or brutal killings. And I think it's fair to say that we have all been touched by your personal stories. Can you identify and share with us what drove you to confront the pain of loss and turn it into action for change? Kristen, I want to start with you there. Many people know that unfortunately you lost a family member, but how did you confront that pain of loss and turn it into action for change?
The moment that my dad got sick from COVID this summer and then subsequently passed away, the pain that I was feeling was unlike anything that I had ever experienced before. And his illness actually started just a couple of weeks after the racial uprisings were happening throughout the country, and also less than a month that I had graduated from grad school, focusing on looking at equitable policy. The confluence of both losing my dad, those emotional feelings, and seeing the unjust world around me playing out, and how people in my neighborhood, my childhood neighborhood where my dad lived, which was 70% Latino, mostly immigrant folks who are working class, essential workers who are out in the fields or in the grocery stores, it all came into such clear focus that I needed to raise my voice because I didn't know who else would from this community. And it really was a calling that I didn't question and haven't really looked back from.
Cleve, did you find the same calling? I mean, when you started engaging in activism, the world was very different. I don't mean to date you, but the world was very different for LGBTQ people, certainly people living with HIV and AIDS. Did you have the same sense of calling at that point, and that's how you were able to confront the pain of loss?
I think a big part of my story was really about just survival. We have made a lot of progress since I was a kid, but I'm sure, I have no doubt that within a mile of where each of us is sitting right now, some young queer or trans person is contemplating suicide because they don't see a place for them in this world. And I was one of those kids that was getting ready to take my own life when I was 15 years old. I thought my life was over. And then I literally read about gay liberation in a magazine, and I flushed the pills I'd been hiding down the toilet and hitchhiked to San Francisco. I didn't really see myself as an organizer. But then I think, as many people know, I met Harvey Milk, and he mentored me and got me to go back to school and study political science and took me with him to City Hall. And at that point in my life, my actual father and I had yet to reconcile. We did eventually, but at that point in my life, I really didn't have a father, and Harvey became that sort of father figure for me. And losing him, the brutality of it, finding his body — I had never seen a dead person before. Just the overwhelming horror of it and the grief of it. It sort of set my course, I think, and it made it, I think, clear to me what I was supposed to do. Now, there were many times I didn't know what form that would take or how I was going to pay the rent, but I had a deep sense of what I was supposed to do. And as horrible as that period was, Harvey was shot on November 27th, 1978. In a way, I think it strengthened me and prepared me for what was to come, because by 1985, almost everyone I knew was dead or dying or caring for someone who was dying of HIV. Again, it was about surviving, getting through that grief, not allowing oneself or one's friends to be paralyzed by the grief, but to take action and to fight back and to understand that that was required of us. So I don't think I ever really had much of a choice.
What about you, Alicia?
I just recently lost my mom, and it was a very quick process. 7 weeks from diagnosis to death. She wasn't sick. I'd never seen her with a cold. And, I think for all three of us, really, I think we could probably agree that death reorganizes you. And it changes the way that you see the world. It changes the way that you prioritize things, and it changes the way that you spend your time. And, prior to my mom dying of brain cancer, I had experienced some loss in my life, people who I knew, people who I was friends with. And those things are awful, terrible, deeply terrible. And this particular experience, I think, was unique for me in the sense that I remember I could literally, as she was passing away, I could literally feel like my cells changing. And, I think for me in this work, I think about all of the people who I have been proximate to, who have lost somebody that they love deeply, whether it be their child, whether it be, their partner, whether it be their friend. And too often these instances are not the kind of experience that I had with my mother having an unexpected illness and, really having all of the care that she needed, having all of the family around her. It was pre-COVID, right? So this was an opportunity for us. I spent 7 weeks by her side. But so often these experiences are actually of people who are having their loved ones stolen from them by completely preventable circumstances. And that is something that also reorganizes you in a different way. I know it's reshaped the way that I think about why I do this work. Because if you've ever heard the wail of a mother who is looking at her child underneath a sheet in the street, then you understand what it is that motivates people to take action and not just grief, right? For so many of us, the grieving is part of the action that we take around these losses are part of our grieving process. It's a way for us to do something about either something that was preventable or something that feels like just within our grasp, but we just couldn't get to fast enough. And ultimately, I think for me, the reason that I do this work is because I never want to hear those wails again. The reason that I do this work is because I know that even though my mother had all the care that she needed, it was literally because there was a social worker in the hospital who was working with us as we were trying to navigate paperwork and doctors and different floors of a unit and all the things, who recognized me, and she knew about Black Lives Matter and she supported the movement. And so she helped to open up opportunities that I knew deep in my heart there were 100 other people on that floor who could never see that. And so this is why we do this work. We do this work to try to prevent other people from having to experience that level of reorganization without control. We do this work to be able to make sure that families can stay together for as long as they're supposed to. And we do this work because we understand that even though this world is deeply unjust, it is actually fixable. And so I know for me, the things that have been clarified for me around death and dying, right, is that if there's anything that I can do to prevent somebody else from experiencing what I've experienced over the last 2 years, what I'll experience for the rest of my life, it is 100% worth it.
Well, thank you all. Thank you all for doing the work. Thank you all for accepting the call, whether it was direct or indirect. And all of you have accomplished so much in your lives through the realm of activism. When you think about what you've done, and you think about the change that you've been able to lead, whether it be changing policy or changing the political landscape or changing hearts and minds. And this may sound like a difficult question because of all of the things that you've done, but if you could identify one thing that you're most proud of, what would that be? Cleve, I'm going to start with you for that question.
I'm still here. Yeah, I've endured, and I think that that's because the movement saved my life and gave me purpose and connected me to other people who make life worth living. And when I speak with young people, I'm so often, now that I'm an old white-haired guy, people say, well, how can I be a better activist, or what can I do? How can I change the world? And I struggled with those questions for a long time, but now I know what to say. I hope everybody finds a way to contribute that brings them joy. And I love my work. I love the people I work with. We suffer defeats, but we get back up and we keep fighting, and it's a constant source of inspiration for me. So I think that the things that all three of us fight for, we're going to be doing this for the rest of our lives because it takes that and it's worth that. And so in order to endure, as I have endured over these decades, I think it's very important to find that way to struggle with joy in your heart. And I'm grateful that I found that way forward.
Kristen, what about you? What are you most proud of in your work, in your activism work?
I wouldn't be here if I didn't allow myself to trust myself. I am incredibly proud of myself for giving myself permission to feel what I have been feeling and to know that it is worthy and possible to fight for what's right. So while I've accomplished a lot in the COVID world, the thing that I know will help me continue to make positive change in the world is to be really centered on trusting myself, and trusting myself in a world that is not designed to trust queer folks, to trust Latina women, to trust folks like us. And I think for me, that has been a huge turning point.
And Alicia, what about you?
Oh,
Um,
I know it's a tough question.
I know, no, I'm like, oh my gosh, no, I was just, my heart is warmed. You know, I hope I don't sound like a broken record here, but the thing I'm most proud of is um, keeping a soft heart while also having a tough skin. This work is hard. And for all of the reasons that you both named and many more, we are trying to build a world that doesn't yet exist, and we're trying to be alive for it. And so I think for me, um, I've suffered so many disappointments. There's so many things that I haven't achieved. And for a lot of people who come into this work, they'll say, oh my gosh, I didn't do this one thing. I can't do this work, right? I'm not cut out for it. I'm not good enough. I'm not this, I'm not that. But I think, the thing I'm most proud of is, yeah, having a tough skin while also keeping a soft heart, knowing that even with all of those disappointments, right, that joy and victory is just around the corner.
I hope that people watching this can sort of see the hope and take the hope from the comments that all of you have made, because you're right, this work is difficult. This work is a commitment that we all make in our lives. And for example, it took years to develop a national response to the HIV pandemic. And for the past 4 years, at least, the national response has been anemic at best, with more people of color being affected with HIV. Our nation, of course, as we know, Alicia can tell us, that still struggles with real action and change regarding civil rights and social justice, with more Black and brown people facing systemic racism and violence. And of course, we're still in the midst of a global COVID-19 pandemic, with predictions of increased infections over the next few months. So this is a question for any of you. What would you suggest to activists and community leaders? What should they do differently today to affect change in the immediate future? Kristen, do you want to take a shot at that?
Sure. I would say keep showing up. I mean, I think it's so easy to, as Alicia just said, say, oh, I did this one thing wrong. Like, I don't have space here. We're all figuring it out. And I think it takes each of us just stretching a tiny bit more in some of the uncomfortable spaces to see the entire realm of possibility a little bit different. So keep showing up, ready to do the work, and we will change the world.
Anyone else? I mean, I think you've already given responses to that help people sort of think about what they should do differently today to affect immediate change tomorrow. I think I see that in all of your work, but to the extent you wanted to add anything else, feel free. Otherwise, I'll ask the follow-up question.
I got something.
Okay.
So we just had a whole conversation about social media. And so I'm going to go with, build community in real life so that we can affect change tomorrow. Quite honestly, there are so many things that I see on social media that don't inspire me to action necessarily. But what I long for most often, and I think so many people long for, is a community in real life that doesn't involve hashtags or profile pictures. And when you build community in real life, real people take action on the things that they care about immediately. So mine is going to be build a community that really exists.
And I mean, we heard about this from the mayors in the previous discussion, where they talked about COVID and HIV/AIDS having a disproportionate impact on people of color. And so activists are on the front lines today, and making sure that you're engaging in a real way to affect change, and specifically for marginalized communities, is so incredibly important. I want to go back to sort of how all of these movements are perceived, or perceived in a disparate way. Not all movements generate the same type of response. In the last year, more than 250,000 people died from COVID-19 in this country, and unfortunately, more people are still dying. but it does not appear that we are seeing or hearing the same kind of outrage that we've seen in other movements. And Cleve, I'm interested from your perspective, what do you attribute to that shift? Do you think it's because COVID or the COVID pandemic itself was hindered by traditional forms of activism, or do you think that is something else?
That's a very good question, and it's something I've been thinking about recently. Is where is the movement that should spring out of this crisis? And I think it's actually there, but it's simmering below the surface because people are right now mostly just coping. I look at my own family. So many of my relatives are out of work. They're home struggling to educate their children. I look at the workers in my union. By early April, 98% of the workers represented by Unite Here had lost their jobs, lost their health insurance. I think that we are a nation that is actually deep in grief right now. We're grieving loved ones that we've lost. We're grieving the loss of employment, the loss of our dreams, the loss of our future. We're grieving the fact that our kids can't have a normal school day. But I think that beneath that, there are some really hard lessons that people are learning. And I think as we move forward, and now that hopefully we're going to see a new president inaugurated soon without any further delay, that there'll be the chance for us now to move through that grief and into action. And that's something all three of us have done in our lives and in our work. I think, for example, the notion that our healthcare is tied to our employment, really, I think people are going to start looking much more carefully at that issue. I think that COVID is shining a very harsh light on some really long-standing inequities within our society. And right now, we're so immersed in the moment of it and the horror of it and the bizarre reality of what Trumpism did to our nation's response to the epidemic. It shouldn't be a political issue, but of course, just like HIV, what part of this pandemic isn't political?
Cleve, I want to just spend a few minutes talking about that issue that you just raised, which is equity. With the promise of COVID-19 vaccines on the horizon, concerns have been raised now about the equitable delivery of vaccinations. And this is not new, unfortunately. We saw this during the HIV/AIDS pandemic. We've seen this with people of color, unfortunately, being sidelined when we're talking about vaccinations. With respect to the intersectionality of all of our movements, how can we work more effectively across movements to ensure that the most vulnerable are not left out? Alicia, I will start with you, that question.
Well, I think first of all, it relies on building relationships across silos. And I know, again, I don't want to be a broken record here, but I think so often the way that people think that change happens is that people get out of bed one day and think that they're going to do something amazing. And that's not actually how it works. It's being inspired, right? But it's also building relationships across places where you may not have been deeply rooted. And in relationship to the distribution of this vaccine and how we ensure equity, it's really about making sure that nobody gets left behind. And so often in our fights for change, one of the carrots that gets dangled in front of some of us, right, is to jump ahead to the front of the line. And we're actually encouraged to leave folks behind and say, okay, well, they'll get it eventually. But we have to resist that. And I think, over the last 4 years in particular, there has been such a spirit encouraged in this country of individualism, right? And leaving people behind, leaving people out, and kind of assuming that it's a social order, right? That it's just kind of the natural way that things should be. But one thing that has given me hope over this last 8 months is that in a lot of ways, what I see is people starting to recognize that we're all in the same, well, let me say it differently, because, we've had some problems with this metaphor. We're all being impacted, but we're being impacted differently. But I think that ultimately what folks are realizing is that, frankly, we depend on each other to survive. And that dependence can either be deeply toxic or it can be deeply liberatory. And so I actually have more concerns, right, that there's a deep lack of trust in the viability of a vaccine under this administration, knowing all of the shortcuts that they have taken, all of the denial that they've engaged in around the scope, the scale, and the seriousness of this pandemic. And I think that will also impact making sure that vaccines are distributed equitably. I think, folks of color and queer folks and folks who have been left out and left behind have a healthy distrust of government-sponsored initiatives. And so there's a lot of work that we're going to have to do here. But ultimately, we are going to have to resist the urge to jump the line. And because we've been in this for so long, I think that urge is actually present, right? So it's really very much about relationships, and it's about kind of using this as an opportunity to demonstrate our best qualities and not our worst.
Well said. You all have provided such rich and thoughtful responses to my questions. And my last area that I want to focus on is the future, the young people, young activists. When we talk about the impact of activism, it shifts depending on age and geography and ideology. And if each of you could speak briefly from a generational perspective, millennials and Gen Zs, what do you believe needs to be done to inspire future activists to engage in whatever they care about? It could be environmental justice, LGBTQ rights, Black Lives Matter, it could be anything. But how do you inspire future activists? And if you can, sort of talk about a message of hope for people to sort of incorporate into their thinking as they think about future activism. Kristen, if you wouldn't mind starting.
Sure. Something that comes to mind immediately, and this kind of echoes something that Cleve shared earlier, is that I always make space for younger folks who seek me out. And I think it's really important for us, I'm an old millennial, and other activists to find time in our schedules to help young folks find their way, because it was, folks along the way that helped us in kind of figuring out our way along the pathway. And so something that I would encourage folks to do is to, if you are inspired by someone, whether it's a teacher or a friend or an activist in your community, is to reach out and make a connection. Take the advice that Alicia has given us to start to build a relationship, because you would be surprised that many of us want to talk to you, because it needs all of us in order to do this work and continue making the change that we want to see in building the world that doesn't yet exist, but we are so deserving of.
Cleve, how about you? How do we inspire future activists?
Well, as I approach 70, I notice that so many of my friends have lapsed into a tendency to scold and try to, push people through guilt and finger wagging. And I'm trying really hard not to become that person. I'm really lucky that I get to interact with so many young people, and I'm constantly reminding myself to help them raise themselves up and let them know how. I so often with young people, I think they look in the mirror and they don't see the beauty that I see when I look into their faces. And I want them to know that they're beautiful, that their lives matter, that they can change the world. And I try very hard to not just make space for them to do that, but to really listen. And I find I have to constantly remind myself to just shut up and listen to these young people and give them the room to tell me what it is that I might possibly be able to do to help them. And then I think also, I just want to say that Alicia and Kristen, I've been so moved by your stories. Alicia, I was following your posts on Facebook all through your mother's illness. It made me weep. And I was so touched by it. And I think I got a much clearer sense of who you are as a human being. And Kristen, when we met at the AIDS Memorial Grove and you told me about your father and how much you loved him, and there's real power in sharing that. So I think that's the other thing we have to do, is to always be willing to open ourselves up and share. And I'm sure, Alicia, it was incredibly difficult for you to share as much as you did with us on social media about your mom, who I feel like I knew the woman. But I hope you know how deeply you moved people and inspired people. And so as difficult and as painful as it can be for us to open up and let people know, hey, I'm hurting, I'm frightened, we need to do that and trust that young people will be able to absorb that information and respond.
And Alicia, parting words inspiring the young generation of activists.
Well, thank you, Cleve. I adore you so much. And all of the things that you say you are trying to do, you are doing. And thank you for it. And Kristen, we don't know each other as well, but I'm rooting for you and cheering you on every single step of the way. And glad that you trust yourself, because I trust you too. I think that for me, the thing that we need to do to help inspire people is to win. And it's also, honestly, right? Everybody wants to be a part of a winning team. Nobody wants to be a part of a losing team. So we have our work cut out for us. But also, I guess if I could give any advice at all, it would be to really sit at the feet of people who have been doing this work for longer than you, not because they know more than you, but because they can give you additional perspective to help you light your way. And then I think the thing that I long for and I yearn for is young people to be mentored by. I am ready to follow, my friends. And for those of us who get pushed out in front, sometimes we want to fall back and be led. So lead me, please.
Alicia, Cleve, Kristen, thank you so much for such an insightful and thoughtful discussion. I want to thank you for your leadership, your activism, your voices that have and continue to make a difference. With our continued commitment to this work, we can all make a difference, and we can all feel a little bit more hopeful about the future. To our audience, thank you so much for joining us. And we commemorate World AIDS Day today with this discussion, which brought us hope, insightfulness, thoughtfulness, and just brilliance from 3 fantastic activists who have been doing this work for years. Thank you so much for joining us.
Good afternoon, everybody. My name is Mike Gifford, and I am pleased to serve as the President and Chief Executive Officer of Vivint Health, America's leading HIV medical home. We are so grateful for our partnership with the National AIDS Memorial, and specifically the AIDS Quilt. Their leadership in the fight against AIDS over the decades has made all of the difference. The quilt is such a powerful tool. It's a tool that allows us to remember each and every soul that we've lost to the fight against HIV. It's a tool that encourages us on to continue our difficult work as we hope for and work towards a world without HIV. To me, the quilt always embraces us, each one of us individually, everybody who's ever been affected by HIV, and our entire country. It embraces us with the strength to have the difficult conversations about moving forward towards the end of AIDS. And that includes those difficult conversations around things like prejudice and poverty, isolation and illness, hunger and homelessness, and certainly sexism and racism. We need to tackle all of these issues as we move towards a world without HIV. Thanks to the leadership of the National AIDS Memorial and the quilt traveling around the country and hopefully even around the world, we will someday achieve that world without HIV.
The year is 1981, and in New York and Los Angeles, small groups of previously healthy, young, gay men contract rare forms of cancer and pneumonia caused by compromised immune systems. This marks the beginnings of the AIDS crisis in the United States. And as a nation, we take action. The scientific community gets to work, and a number of organizations are born with the desire to care for the sick and at risk. The year is 1987, and Ryan White, a child from Kokomo, Indiana, is thrust into the spotlight and becomes the face of HIV advocacy and inclusion. He becomes a champion of compassion over condemnation, love over hate, and hope over fear until his death 3 years later. And we carry on his legacy. It's the 1990s, a time of advancements in treatment and policy, improving outlooks for people living with HIV, and we pioneer new services aimed at prevention. It's the start of the millennium, a generation after the fight against AIDS and HIV began, and the challenge is evolving. People living with HIV are increasingly diverse, and we adapt with new, more inclusive strategies. It's August of 2020, and we face an unprecedented challenge, a global pandemic caused by COVID-19, disrupted by the virus, our economy struggles, uncertainty, and unemployment rise, and a movement to create genuine equality is underway. These are the conditions to which we must respond today. The time is now to join together as advocates, politicians, and citizens and unite. This is how we overcome racism, poverty, and oppression. This is how we do better. This is how we thrive together. This is how we make HIV history.
You know, when this all started, I started dreaming about patients and people that I hadn't thought about consciously in years, and kind of re-experienced caring for people with HIV that I took care of at San Francisco General who died young.
It was 1983. I was a nurse in New York City, and it was the beginning of the HIV and AIDS epidemic.
There was a lot of stigma and a lot of fear and panic. And we attempted to care for ourselves as best as we could with the amount of knowledge that we had. We didn't have tests, we didn't have treatment, and we had a lot of sick people.
You never know really what someone is going to say to you or do for you that's going to be transformative in how you cope with an HIV diagnosis or a COVID-19 diagnosis. And for me, it was a random nurse, when I was dying in a hospital bed, in Atlanta, Georgia, who, without gloves, without gown, any protection, for the first time ever coming over to me and touching me on my shoulder and saying, "Honey, it's going to be all right." And if it weren't for that moment, I don't know if I would have had the impetus to kind of struggle through and just say, I can do this because she's not afraid of me. She cares for me.
And not only the doctors and nurses, the people who gave comfort. So many women, gay women to be exact, were such an integral part of sustaining myself and my other friends who were infected with HIV and AIDS.
Sneaking out medications if they were in the healthcare field, just really doing kind of guerrilla warfare when it came to HIV treatment.
I felt a lot of anger, and I was very motivated and energized. It was a good kind of anger about what was happening in our country about this epidemic, with funding, with research, and then with my friends and neighbors who were dying. Who would I?
You cared about what you did and you wanted to help people. And I see it today. The healthcare workers, they're there on the front lines, in the emergency rooms, in the intensive care units, because they want to help people. They know that they're at risk.
They're working with patients with a highly contagious virus and putting themselves very much at risk every time they go to work.
I feel it so deeply that it's hard to express myself without this.
Thank you so much to these true activists who continue to impact our society through their tireless work and advocacy. As we move to our keynote conversation, which will focus on 4 decades of medical and scientific leadership for the AIDS community, there is a touch of deja vu, if not PTSD. So many of us remember a time when our government and nation turned its back on us, refusing to acknowledge the AIDS pandemic, dismissing it as a gay cancer, and so many did not follow science. As we reach new shocking rates of infection and mortality on a daily basis, we again seek greater medical and scientific leadership as we again navigate through very dark days. Dr. Anthony Fauci and Dr. David Ho, who we honor today, have stood on the front lines of medical and scientific advancements. They understand what 40 years of AIDS has taught us. It is through building alliances among community, government, and the private sector that together we can make progress and save lives. The same is true for COVID-19. And here to introduce the discussion that highlights the importance of science, medicine, and leadership in pandemics is Daniel O'Day, CEO of Gilead Sciences, who has been dedicated to the development of therapeutic treatments to combat both HIV/AIDS and COVID-19.
When COVID-19 first came into our lives this year, we knew very little about the disease. The scientific community had only just begun to understand its devastating potential. At the same time, there were many lessons we could draw on from the past and knowledge we could build on. The fight against HIV/AIDS had taught us many of those lessons. We learned that with perseverance and a commitment to following the science, we can lessen the impact of a disease that seems unbeatable. We have a long way to go with COVID-19, but we have already seen that science offers hope. All of us at Gilead are grateful and humbled by the fact that our antiviral medicine, Veklury, has been shown to make an important difference for patients with COVID-19. We were able to help not because of luck or accident, but because of decades of following the science. Our work in antivirals gave us the knowledge and expertise to move quickly. Another lesson from the work against HIV/AIDS is the importance of collaboration. We all share one goal, which is to end the human suffering caused by the disease. By bringing together public and private sectors, we have a much greater chance of progress. As we look to the future, the principles of following the science and collaboration will continue to guide our efforts in both HIV and COVID-19. These are the greatest public health challenges of our time, and with robust science and strong leadership, we can afford to have hope in the future. Dr. Fauci and Dr. Ho are 2 great leaders with vast experience of bringing public and private sectors together for the benefit of patients. Gilead is proud to have been a part of those efforts. I'm pleased to introduce Drs. Fauci and Ho for this next part of the program. Dr. Jennifer Ashton, Chief Medical Correspondent for ABC News, will moderate this important discussion. Thank you to the National AIDS Memorial for hosting this important forum.
Hello, I'm Dr. Jennifer Ashton, the ABC News Chief Medical Correspondent, and I'm delighted to be here today to serve as the moderator for this incredible and very important session. Of course, I've known Dr. Anthony Fauci some time now and have had the distinct honor of working with him covering the COVID-19 pandemic over the past year. And of course, Dr. David Ho is legendary in the HIV/AIDS world, and we share some of the same alma mater. So multiple connections, and it's an honor for me to be able to moderate this important discussion with both of you. Dr. Fauci and Dr. Ho are both being honored for their long commitment work and the profound impact they have had over the span of the last 4 decades, and at least 2 epidemics, of course, AIDS and COVID-19, and their incredible leadership in advancing science, medicine, treatment, and education around both of these infectious diseases. Of course, Dr. Fauci has been the public face of the COVID-19 pandemic, as was during the darkest of the AIDS pandemic. Just as he did then, he provided sound scientific leadership, assurance, and tremendous hope to the country during these very difficult times. Dr. David Ho has worked in the same veins, working on groundbreaking contributions in virology, cutting edge, state-of-the-art, particularly the recent publications on COVID-19 and 2023 that have been critically important during this current pandemic. A lot of parallels between this and the HIV/AIDS pandemic, and very much like the HIV scientific discoveries that Dr. David led during his work at Aaron Diamond, which provided such hope to so many people during the AIDS pandemic. So I want to welcome you both, Tony and David, and let's jump right in now. You're both joining a list of honorees as recipients of the National AIDS Memorial Leadership Recognition Award, one of many, many such awards that you've gotten, but certainly, I'm sure, one of the most meaningful in your lifetime work against AIDS. Can you both reflect back on the darkest days of the AIDS pandemic and bring us back a little bit in time to how you both felt and what the overall vibe was and what it was like for you both as doctors to see such a massive loss of life, and what is it like right now? Tony, why don't you start?
Yeah, well, thank you, Jen, and thank you for giving me the opportunity to be on with you, and together with David Ho, and David and I have really, as we've often said, very apropos of your question, have really been through the wars together on this. When I do reflect back on those very early years, it was a totally unique experience as a physician and a physician scientist. I made a decision in the summer and the fall of 1981, when the cases were reported, that I would change the direction of my research. And as I think I may have mentioned to you, I had been involved in the developing of what were very effective therapies for a variety of unusual, not rare, but unusual immune-mediated diseases, like the whole spectrum of the vasculitides, with extraordinarily good results. So I was in one of those runs, as it were, when you say you're having a good run. We were having a good run because patients who supposedly were going to die from these overwhelmingly fulminant vasculitic inflammatory diseases did very well. When I started to see individuals and brought them into the NIH Clinical Center, everything changed. My life changed. My professional life changed. And even my personal life changed, because I found that I and one or two of my colleagues who were trying to do research in a situation where you were completely consumed with trying to take care of desperately ill patients, with the outcome that was dramatically different from what I had experienced prior to that, where success was the rule and failure was the exception. Whereas there you were dealing with, uniformly young men, almost exclusively gay men at the time, who had advanced disease for which you could do nothing but, as we would say, put bandages on hemorrhages. And it was the dark years. And it wasn't a dark month or 2 or 3. It were dark years. You try to do some research, which we did. We did some pretty good research. At the time, it was the low-hanging fruit. but everything was dominated by the suffering and the pain and the inevitable bad outcome of the patients. So, I don't wish that on everyone, but it was something that shaped, how I looked about medicine and success and failure in the subsequent years. I cannot believe it, but I look back now, that was almost 40 years ago that I was doing that. And it's an experience that just doesn't leave me. I use it as a vantage point to look back and compare what we're doing now with what David and I went through back in those years. It was most extraordinary.
What was it like for you? What were your clinical thoughts then, and what were your emotional thoughts then?
Well, clinically, since, I am a clinician, I'm an infectious disease doctor, and I'm an immunologist, so it was right in the area of what I had been doing. So I was spending much more time on the ward with my colleague Cliff Lane and Henry Mazur, who were with me back then, than we were able to spend in the lab. But it was almost constantly from room to room with a bunch of extremely talented and brave nurses and other healthcare providers. But it was, emotionally up and down, because you related to these people. They were young men who previously had been very healthy, and they were in a mysterious disease. In 1981, 2, and 3, we knew it was an infection. It had to be an infection. We knew that it was new, but it was a very unique experience dealing with something that was killing a lot of people, and you didn't know what it was. That is a very unique experience in medicine. And it was, I wouldn't say frightening, but it was dark. It was mysterious. It was disturbing. But you just, you mustered up all your clinical skills, but, you would get rid of one opportunistic infection, and then another one would come up, and then you get another one, and then another would come up, and the next thing you knew, a person had overwhelming Kaposi sarcoma, and they would die. And it was one after the other. And you had to deal with the emotional strain at the time of families who were rejecting their children because, A, they found out they were gay, and 2, they found out that they were sick with this strange disease. So we had a lot of sociological issues that we were dealt with. It was a much, much more complicated issue than what we're dealing with now, which is very, uniform. Everyone's afraid of this virus, and we know what it is. We've identified it, et cetera. This was pure mystery. It was dealing in a mysterious world that, I think most of us, believe it or not, have some form of post-traumatic stress, I'm sure.
Yeah, and I agree with you, Tony. And David, when you look back onto your memories from those early days and the 40 years almost what kind of parallels have you personally been feeling and experiencing as we deal with this new RNA virus, another one? What parallels for you have you been noticing?
Well, first of all, thank you, Jennifer, and thank the AIDS Memorial for this recognition, especially shared with Tony. I'm very grateful. Thinking back, I was a young physician then, just finishing training in internal medicine. And as Tony said, this was a mysterious illness that was seemingly transmissible, and it was killing young gay men one after another. And as Tony mentioned, they were often dying alone, shunned by family and friends because of this transmissible illness. And we knew it was obviously spreading, and yet there was no effective intervention that was meaningful in any way. So that certainly was the darkest period. And then, a lot of research took place and progress was made. And a decade into the pandemic, there was still very little we could do in terms of making a dent on this, on treating this disease. And I recall in the early 90s, it was devastating because the pandemic had grown by then and people were still dying in huge numbers. And you could say that was just before the arrival of combination antiretroviral therapy. To me, that was another darkest period in this pandemic. And then contrasting that with COVID-19, it obviously, there are gross differences and yet certain similarities. You know, HIV/AIDS was relatively speaking slow and insidious, and yet COVID-19 hit us like a tsunami, right? And the discovery of the causative agent took several years for HIV/AIDS. It took a week or two for COVID-19, and the sequence took many months for a huge number of teams to work out, and the sequence took only a few days to work out this time. So there are a lot of contrasts. And as you just discussed, the therapies took a long time to come, but for this new pandemic, it looks like the vaccines and therapies are emerging extremely rapidly in an unprecedented fashion. So there's a lot of similarities and yet lots of drastic differences.
And David, you set that up perfectly for my next question, but to stay more right now on HIV/AIDS, so many people in the world of infectious diseases and in the HIV/AIDS communities, this has occurred with such unprecedented speed for COVID. Why almost 40 years later do we still not have a vaccine against HIV? How do you respond to that?
I think it's certainly not due to lack of effort or lack of funding. Tony's Institute has invested billions of dollars to develop the vaccine, but the fundamental problem posed by the virus is the major obstacle in coming up with a successful vaccine. It is a virus that's mutating constantly, and we are confronted with not just one virus, but an array of different viruses that diverge in their sequence. In addition, HIV, in contrast to SARS-CoV-2, the causative agent of COVID-19, seems to have its glycoprotein, the protein that sits on the surface of the virus, well shielded. And so it's not as easy to induce antibodies that are capable of neutralizing the virus compared to SARS-CoV-2. Our recent efforts suggest that it is extremely easy for an infected person to very rapidly mount a strong antibody response that could neutralize the virus. And yet for HIV, while you may be able to mount such a response against the infecting strain, it doesn't go across and cover other strains so easily. So to us, working in this field, that's the fundamental challenge in coming up with an HIV vaccine. Work is still progressing, as many people would tell you, and there is hope for a vaccine later on for HIV/AIDS.
And Tony, in the HIV world now, over the course of the last 40 or so years, could you have imagined that you would get to the place where, for the lay people listening to this and watching this, you equals you, that a diagnosis now of HIV for a lot of people, because of the incredible improvements in therapeutics, is now not a death sentence, that it's a chronic condition, and that being undetectable actually can make someone unable to transmit the virus. How has that evolution been for you from your vantage point, and what is new on the horizon that you think people should know about in terms of HIV prevention and treatment?
Yeah, well, going back to the day when David and I were struggling to keep our patients alive with no interventions, at that time, we didn't know what the virus was. When we found what the virus was, there were a lot of things that evolved from that. The frustration with vaccine, when we learned, as David alluded to, that the body was not giving us any hints as to how to get a vaccine, because in the field of vaccinology, the proof of concept is how you respond naturally to the infection. If your body makes a really good response, the chances are you're going to be able to do a vaccine. But the ominous thing that we found out slowly, but then it hit us right between the eyes, that the body does not like to make a neutralizing response against this virus. But with therapy, it was different, because once you got the replication cycle and the birth, I wouldn't say the birth of, but the coming into its own of the discipline of targeted antiviral therapy, we were able to gradually, first with a single one, and then we learned that this is a very, very smart virus in its ability to evade a single antiretroviral, which led to the combinations over a period of years. But I can tell you, Jen, I would not have thought back then that we could get antiretrovirals that you could give to individuals over a long period of time and really totally knock out and block the virus to the point where you could have people, and many of my patients now are decades into, those who were fortunate enough not to have a whole bunch of resistance develop before we had the triple combination, are doing spectacularly well. So we have the ability to bring the virus to below detectable level, which has a major impact on the health of an individual, leading many to lead almost normal lifespans. Not quite, because of the other effects that occur, the premature aging and the other organ system issue. So that was a major advance to realize that you can actually stop the disease in its track. You couldn't just slow it down. You could really stop it. That's the first thing. The second thing, that's durable, because if you block replication, the virus that does not replicate does not mutate. So if you could actually block it, you could have a long range effect. But then the thing that was hinted at with the study, it's really, it's kind of a beautiful evolution over years. You get hints that, there is a relationship between the level of virus, both in pregnant women, whether they transmit it to their babies, or in sexual partners, what's the likelihood, and the concept that the lower the level of virus, the less the chance of transmissibility. That was great news. But the thing that blew us all away was the fact that if you actually got the level by therapy to below detectable, that the virus just did not transmit. And there was a lot of skepticism saying undetectability was untransmissible. But now, in literally tens of thousands of people in cohorts, we're seeing that that's true. That if you really do get the virus consistently below detectable levels, you do not transmit, which becomes a major twofer. And the twofer is you save somebody's life and you prevent them from transmitting the infection to someone else, which I think you cannot underestimate you can't overestimate how important that is. The other thing you asked as the second part of your question is, what do you see for the future? I mean, pre-exposure prophylaxis, which I must say, if you grew up in the classic arena of infectious disease, prophylactic therapy always has a lot of caveats to it. Do you really want to prophylax somebody because of all of the possibilities of toxicity and resistance? And then we find out that PrEP is a huge home run if used appropriately. And now we're trying to make PrEP easier to administer, such as the really important advance in long-acting cabotegravir and long-acting monoclonal antibodies, the kind of things that David and his colleagues have been working on, that you could actually give to someone both for treatment as well as for prevention, so that you don't have to be having medication every single day. I think from the standpoint of compliance with therapy, that's going to be very important. So even today, 40 years into it, we're still making more and more advances that are making treatment and prevention better, more effective, and more user-friendly.
And I want to shift gears a little bit now, again, in focusing on the similarities, the differences, but in medicine, we all know you can't treat a person without understanding their psychology, their mindset, the emotional, psychosocial issues that are being brought to bear that particular patient or population. So much of the success that was experienced with trying to address HIV/AIDS, certainly from the get-go, had to do with mobilizing people's behavior, trying to affect positive and safer behavioral changes. We're also dealing with that right now. David, why don't you start? Where do you think those challenges lie today with the pandemic, with the COVID-19 pandemic? What have we learned from the HIV/AIDS world that can help us inspire positive behavioral change and understand the psychological mindset?
Yes, so I'm a virologist, not a psychologist or a psychiatrist, but it's human behavior is quite challenging to predict and certainly to modify. I think we have learned that in HIV, for example, wearing a condom could go a long way to prevent sexual transmission of the virus. And in COVID-19, wear a mask would similarly cut down transmission. But it's very hard to get people to apply some of these measures, as Tony knows better than anybody else. And that's human nature. I think when it comes to prevention in particular, our citizenry has a feeling he or she is typically an exception to the rule. And yet, if one puts oneself in a risky position, whether it's related to HIV or SARS-CoV-2, the virus doesn't discriminate. And so when it comes to behavioral modification, I think we are only going to be successful to an extent. And that's why we need multiple tools in our toolbox for prevention of these transmissible diseases. And this is where we need to not count on one thing, but on multiple applications. This is why we need to apply the mitigation measures, but also at the same time develop vaccines or drugs or antibodies so that we could use all the tools at our disposal to combat the pandemic.
Tony, I know as David started, I know he's not a psychologist, although I think he underestimates his own understanding of the human psyche. You're not a psychologist either, but yet it seems so much of your public statements in the last couple of months have been focused on really trying to get at people's behavior and understanding their psychology. Where do you think we are in terms of the COVID-19 pandemic with respect to that?
One of the issues that we face in the United States, Jen, is that if you look at what is going on, these kinds of subtle issues that influence a person's behavior, one of the things that has been dominant and very, very difficult to deal with COVID-19 is the divisiveness in our society, in which messaging and conduct related to one's own personal responsibility as well as your societal responsibility has been really completely distorted by the divisiveness where public health measures have taken on almost a statement as opposed to whether or not it's going to have an impact on the broad health of everyone. It's It's, well, you know that. I'm telling you things that you've lived through and that David has lived through, how you could have a situation where you talk about behavior. I've been dealing with this over the last few days as the virus has surged in certain states, such as in the northern plains and in the Northwest, where you have places like Montana and Idaho, where because of the nature of the healthcare delivery system, you have good healthcare there, but it's not surgible in the sense of it cannot surge up very well. And you have intensive care units where you have 25 beds in a big hospital in Montana, and you have 45 people who need intensive care. So there's not only a shortage of beds, there's a shortage of staff to adequately care for the people. And yet in that environment, you still have people who refuse to wear a mask, who refuse to have physical distancing because they think all of this is a hoax or it's fake news. We didn't have that with HIV. There were another set of behavioral issues that got in the way. But this is an extra added something that I have never experienced with, and I am really stunned by it and amazed by when you have evidence all around you that what you're doing is detrimental not only to you but to society, and you have a way to prevent it, but you don't do it. That adds an extra layer of challenge to the already challenging issues that David so appropriately brought up, and about how you can develop things in a multiple way. I mean, that's the reason why when David and I talk about prevention, we talk about it as a multifaceted combination where not one size fits all, depending upon where you are. It becomes a little bit more uniform when you're dealing with a respiratory virus that you know is spread and you know the circumstances in which it is spread. So although there are similarities, there are a lot of differences there.
And David, where do you think we need to be to restore the trust and faith and confidence in science and in medicine based on the ground we've lost, unfortunately, in 2020 with the COVID-19 pandemic, amidst the scientific grounds that we've made with unprecedented global medical scientific collaboration? What can we do in the United States to improve and to help heal the damage that's been done to science and medicine?
Well, I think we have to restore faith in science among the public. There's a lot of disinformation spread in recent years. That's not healthy for our society. I think there is a responsibility and a duty on the part of scientists to convey what we do in plain, simple language so that the message gets across to the general public. And I think the benefits of science and technology ought to be clearly pointed out. I mean, just look at what medicines have been delivered by science, medicines and vaccines and various technologies. Life expectancy has doubled in the last century, for example. And as we just discussed, automatic death sentence has been transformed into a manageable condition because of the science delivered on HIV/AIDS. In addition, we are having this conference call, this Zoom discussion is because of science. And people could do a lot on their smartphone because of science and technology. And so the appreciation for science ought to be there, and this ought to translate into the current pandemic as well as our challenges with the climate. And so we need to take politics out of science and medicine. And that has happened too much in recent years.
David, where do you think the next decade will, specifically in the world of HIV/AIDS, but in the world of virology as well?
Well, specifically on HIV/AIDS, we still have major challenges remaining, even though the therapeutic advances have been pretty impressive. We don't have a vaccine yet, and so that's almost the holy grail in the field. In addition, patients would need to continue to take the medications. We need to continue to pursue a cure. Both of these challenges are rather daunting, but we must try, because down deep we know that there will be a breakthrough that will come and allow us to achieve those ultimate goals. I think the current COVID pandemic is actually teaching us to imagine the previously unimaginable. Look at the challenges posed by this pandemic, and yet look at the response. And it's truly amazing that vaccines could be delivered in such short period with such high efficacy. And so many things were advanced with great urgency. It's really telling us that we could do even better in the future against other similar challenges.
And Tony, you mentioned a twofer before. If you could, what's your twofer, if there's one, for people living with HIV who are so nervous right now about this other virus, SARS-CoV? What should they know right now?
Yeah, I don't know if I could call it a twofer, Jen, but I think there are things that we're learning, and that's one of the things, tagging on to the beauty of science and how we sometimes can do what it was unimaginable years ago. I think we also need to realize that science and gaining information now, as something evolves, when you're in an evolving field in which you don't know everything at any given time, I think an important part of science is the humility and the understanding that science is self-correcting, that data that leads you to a recommendation or a course of action now, when the data changes later on, you've got to change how you approach. And I think that's, I believe, one of the beauties of science is that it creates in you a humility that you don't know everything at any given time. So when you're dealing with a person living with HIV in the era of COVID, I mean, what we do know that it looks like individuals who are living with HIV, who don't have any other underlying conditions. They're on antiretroviral drugs. They have an undetectable viral load, and their CD4 count is generally within normal range. They don't appear to be at any greater risk of severe outcome as anyone else. But when you look that there are underlying comorbidities that are associated with living with HIV that actually put them in the category, be that premature aging, be that a variety of other of the list, that's where you get into the situation that you're in. So one of the things that we would like to see, David has been a leader in that, is that in the arena of cure. I mean, if we really could cure an individual of HIV, could we in fact eliminate those aspects of the comorbidities that are associated, that you could really get someone to live truly a normal lifespan and not have some of the risks that are associated with having a disease that has a low level of chronic immune activation that continues to be a danger to an individual from a variety of other issues, not just necessarily the virus itself. So I would think that we are going to, and I'm certain of this, based on what each of us, David and I, have been saying over the last, discussion period, that science is extraordinary because it really allows you to imagine the unimaginable, because historically we've actually done the unimaginable over so many years. One of them is the experience of having a virus that we didn't even know what it was until first week in January, and now we're distributing vaccines within the next few weeks that are 95% efficacious. That truly is unimaginable.
We could continue this conversation indefinitely, but unfortunately time constraints. So the last question quickly to both of you is about hope. We heard earlier in this World AIDS program an incredible song bearing that title, that name. What message of hope do you have for the world on this World AIDS Day? David, you go first.
Well, I think I will come back to science. I think science will deliver solutions for both HIV/AIDS and COVID-19. I think we have to, given the unprecedented mobilization of the scientific community to address both of these problems, I think vaccines will be forthcoming, better treatments will be coming. And in addition to all that, I think we will come up with testing strategies to help reopen our societies as quickly as possible.
Tony?
Well, I mean, I just would have to echo what David says. Hope in two directions. One, the hope of what science itself would deliver, but also the hope that the world will much more appreciate the importance of science, so that we can really cut science loose in the sense of getting more people involved and utilizing the enormous potential of science, particularly getting young people involved in making science a career, whether it's the biological sciences or the physical sciences, but just the extraordinary potential of this, which has really brought us, as David had mentioned, from a situation in which it's essentially had the capability of doubling one's life expectancy. Perhaps we can then have it really make people live much healthier lives, pain-free and disease-free. So that's my hope. Thanks.
I want to thank both of you, Tony, David, your time in this incredibly important conversation. As you both know, I think my medical specialty is OBGYN. And trust me when I tell you, it is a true honor, professional honor for me to be able to share with you. So at this time, it's now an honor I have to introduce John Cunningham. He's the Executive Director of the National AIDS Memorial, who will present you both, Dr. Anthony Fauci, Dr. David Ho, with the National AIDS Memorial Leadership Recognition Award. I congratulate both of you and thank you for your careers and your past, present, and future really, truly on behalf of the world. Thank you. John.
The National AIDS Memorial is so honored to bestow its 2020 National Leadership Recognition Award to Dr. Anthony Fauci and Dr. David Ho. For nearly 4 decades, these two individuals have heroically stood at the forefront of medical and scientific innovation, helping to bring about positive outcomes with both search for a vaccine as well as therapeutic treatments. The National AIDS Memorial, as we honor Dr. David Ho and Dr. Anthony Fauci, are honored to place both of their names within the circle of friends. These two heroes join thousands of others who have either left us or have also stood heroically in the fight against HIV and AIDS.
The way we see it, the impossible
is not impossible.
The impossible is simply what hasn't been achieved yet.
So we pursue it.
We chase it down.
We tackle it for answers.
We surround it for a way in. This is how every once impossible breakthrough has ever been created.
A revolutionary approach to cancer therapy.
A path to a cure for HIV.
A cure for hepatitis C.
A better, healthier world for every person to live in.
None of this is impossible now because of the people you work with,
the communities we stand with,
and the partners we push forward with.
Together, we've created what's possible through science,
grit,
compassion,
and courage.
And we will do it again,
no matter what.
No matter the stakes.
No matter who says we can't.
When faced with the impossible, we don't falter.
We band together, and we prove it wrong.
The impossible
is not impossible.
It's what's next.
C'est notre futur.
우리가 다음에 해야 할 일입니다.
قدم بعدیه.
ano ang susunod.
Es lo que sigue.
呢個就係我哋嘅下一步。
It's what's next.
Thank you, Dr. Fauci and Dr. Ho, for that insightful, honest, and hopeful conversation. You have both been inspirational leaders, and we thank you for your service to our nation. Your voices and your work have been and remain constant pillars of stability. Each year on World AIDS Day, thousands of panels of the AIDS Memorial Quilt are typically on display in communities across the country. As with this observance, COVID has made in-person displays impossible. So instead, the National AIDS Memorial has worked with its partners to continue this tradition, and today officially launches its first ever AIDS Memorial Quilt virtual exhibition featuring more than 10,000 quilt panels representing all 50 states and U.S. territories. The virtual exhibition will run through March 31st, 2021, and is an historic effort to use the power and beauty of the quilt to help our nation reflect and heal during these difficult times. Introducing the exhibition is the National AIDS Memorial Virtual Choir, which brings together voices from across our nation to perform a production of Will I from Jonathan Larson's Broadway musical Rent, and the spiritual Amazing Grace, featured against the backdrop of our beloved quilt.
It really boils down to this, that all life is interrelated, that we're caught in an inescapable network of mutuality, tied into a single garment of destiny.
Will I lose my dignity? Will someone care? Will I wake tomorrow from this nightmare? this nightmare.
This is the structure of our universe. This is its interrelated qualities. We're not going to evolve into better spiritual beings until every man, woman, and child learns and accepts the interrelated structure of our reality.
That performance was so moving, and to see the beauty of the quilt, so touching. I hope you will all take the time to visit the virtual quilt exhibition. As with AIDS, COVID-19 continues to have ever-increasing numbers of lives lost. It is critical that we always remember that each life is more than a number. It is a friend, a lover, a brother, a sister, a parent, a relative, or a neighbor. So now we have come to the end of the 2020 National AIDS Memorial's World AIDS Day Forum. We trust we have moved you to action and that the dialogues have brought you hope and inspiration. On behalf of the National AIDS Memorial Board and staff, thank you to all our special guests and moderators, and to all the people who worked so tirelessly to bring this observance to you. We would not have been able to do this without the support of our partners and sponsors, which include Gilead, Chevron, Quest Diagnostics, Vivint Health, and Wells Fargo. And finally, thank you to all who have joined us from across the United States and around the world. Remember, today is Giving Tuesday. Please consider making a donation to the National AIDS Memorial or a charity of your choice. In closing, I would like to ask you to protect yourselves and others by wearing a mask and practicing social distancing. At the National AIDS Memorial, we have never doubted that one day we would overcome AIDS, and we have no doubt that we will overcome the coronavirus. Remember, we are all in this together. We are one family. Please stay safe and well, and thank you from the bottom of our hearts.